What can I do to increase the chances of pregnancy when a woman is having PCOD? And okay, I'll ask you the next bit later. But what can I do to increase the chances of pregnancy with a woman having PCOD?
So, the first thing you can do to improve fertility, right? What she's asking about is to get a pregnancy. Yeah. First thing is have a routine exercise schedule in your day to day routine, and then watch what you are eating, where you are having more calories. The second most important thing is rule out thyroid also, and of course, you need a gynec consultation, and then have a follicular tracking done, which is an ultrasound tracking of which day actually you are releasing an egg, that is which day ovulation is happening, or maybe if you are not ovulating also, that will be known through that tracking of ovulation. And then if we know that this is the day where you are ovulating, then we explain that those are the fertile days, which will help in improving the fertility. But then if there is no ovulation, which we can know through this follicular tracking, then we will include that medication also in her treatment. Those are called ovulation induction drugs. So who needs this medication and who doesn't need will depend on the result of the follicular tracking.
Can you put some light on follicular tracking? What exactly is that?
So as I said, the egg or ovum is released on the 14th day of the cycle if it is a 28-day regular cycle. So that egg is released from what is known as a dominant follicle. This is what I said, right? So the follicle get released from the dominant follicle on the 14th day. So we start tracking this dominant follicle on ultrasound from day 11 or day 12. If you take the first day of the menstruation as a day 1, that is how the counting starts. The first day of the bleeding. Even if it is in the evening or night, it is called a day 1. So from there, if you count, on the day 11, we do a transvaginal ultrasound, wherein the follicle can be seen and it can also be measured on the ultrasound. Yeah. So once it is more than 10 millimeters, we call it as a dominant follicle. And we check it again with a gap of 48 hours. Like suppose today is my 11th day, I again have to check it on the 13th day. So if that follicle has grown from around 11 millimeters to 14 millimeters, so that is the follicle which is going to release the ovum or egg that cycle. So we again track it until it becomes 18 or more than 18 millimeters in size. So when it becomes 18 millimeters, then we can actually point out that yes, this follicle, this is the one which is the dominant follicle. Then we may give trigger. Trigger is a medication which is given to release the egg from that dominant follicle. It is not compulsory to give a trigger, because once the follicle reaches to that size, definitely it will release the egg. But timing of that egg release is a difficult thing, because when a patient comes to me, so I see a dominant follicle on day 14, and if the husband is traveling out, so it is very difficult for me to exactly pinpoint the fertile days. So if I give a trigger, when I give a trigger, within 24 to 36 hours of the trigger, egg will release. So that will help the couple in identifying the fertile period. If there is no issue about pinpointing the fertile period, then we can say that the next 4 or 5 days are fertile. Yeah, so that is what actually is the follicular tracking. And we also see after the ovulation is over, so to decide whether it is done or